If you're over 60, the greatest threat to your heart may not be what you're eating. It may be sitting quietly in your medicine cabinet. Today, we're not talking about stopping medications on your own. We're talking about understanding how certain commonly used pills can interfere with your body's natural metabolic signaling, the same signaling that protects your arteries, brain, and heart muscle. Because heart disease is not simply bad luck or old age. It is, very often, a mismatch between modern chemistry and ancient biology. Most people believe heart attacks arrive suddenly, without warning, like a lightning strike out of a clear sky. But inside the body, the process has often been unfolding for years, driven not just by what we eat, but by how our metabolism is being chemically steered every single day. Many commonly used medications in older adults can quietly push the body toward a state called insulin resistance, a condition where cells stop responding properly to insulin, forcing the pancreas to release more and more of it just to keep blood sugar stable. Elevated insulin is not just a blood sugar issue. It is a powerful growth signal that tells the body to store fat, stiffen blood vessels, retain sodium, and activate inflammatory pathways that damage the delicate lining of the arteries. Scientific research has shown that chronically high insulin levels can accelerate endothelial dysfunction, the earliest step in atherosclerosis, long before a blockage ever appears on a scan. This means that even when cholesterol numbers look acceptable, the metabolic environment may already be primed for plaque instability, clot formation, and reduced oxygen delivery to the heart and brain. Some medications can worsen this by altering how muscles absorb glucose, reducing mitochondrial efficiency, or disrupting hormonal signals that normally help maintain metabolic flexibility. The result is a slow drift toward higher fasting insulin, increased visceral fat, and a pro-inflammatory state that makes arterial plaques more likely to rupture rather than remain stable. What makes this especially dangerous in the elderly is that aging tissues are already more vulnerable to oxidative stress, so the combination of metabolic strain and medication-induced insulin elevation can act like adding fuel to a smoldering fire. Studies consistently show that insulin resistance is strongly associated with increased cardiovascular events, even in individuals without diagnosed diabetes, because the real driver is not just sugar in the bloodstream, but the hormonal storm happening behind the scenes. When insulin remains elevated, the body shifts into storage mode instead of repair mode, prioritizing fat accumulation and inflammation over cellular maintenance and vascular healing. This is why two people can take the same medication, yet experience very different outcomes depending on their diet, activity level, and metabolic health. The encouraging reality is that the body responds remarkably quickly when we restore insulin sensitivity through simple, biologically consistent behaviors like eating protein-rich whole foods, reducing refined carbohydrates, and moving after meals to help muscles absorb glucose naturally. These actions lower insulin demand, calm inflammatory signaling, and improve endothelial function, often within weeks, not years. The heart is not just a mechanical pump. It is an organ deeply influenced by metabolic chemistry, and when we reduce the constant pressure of elevated insulin, we remove one of the most powerful hidden stressors it faces. Understanding this connection transforms the conversation from blaming age or genetics to recognizing a modifiable signal, one that can be influenced every time we choose how to nourish and move our bodies, giving the cardiovascular system the conditions it needs to protect us rather than struggle silently beneath the surface. Hidden beneath the surface of many daily medications is a quiet biochemical trade-off that most people are never warned about, a depletion of essential nutrients that the human heart depends on every second to generate rhythm, energy, and life itself. The heart is the most metabolically active muscle in the body, beating over 100,000 times a day. And to sustain that relentless workload, it requires a constant supply of magnesium, potassium, B vitamins, and coenzymes that drive mitochondrial energy production. Yet, research has shown that several commonly used drugs can interfere with absorption, increase urinary loss of these nutrients, or block their activation inside cells, creating deficiencies that develop so gradually they often go unnoticed until symptoms appear. Magnesium, for example, is involved in more than 300 enzymatic reactions, including those that regulate heartbeat stability, and even mild depletion has been linked in studies to arrhythmias, vascular constriction, and increased risk of sudden cardiac events. When magnesium levels fall, calcium can flood into heart muscle cells unchecked, causing them to contract harder and recover more slowly, a physiological strain that over time contributes to stiffness of blood vessels and elevated blood pressure. At the same time, depletion of CoQ10, a molecule essential for mitochondrial energy generation, can impair the very process by which heart cells create ATP, the energy currency required for every contraction, leaving the heart working harder while producing less power. Scientists have observed that reduced CoQ10 levels are associated with fatigue of cardiac tissue and diminished resilience under stress, particularly in older adults whose natural production has already declined with age. B vitamins play another critical role, helping control homocysteine, an amino acid that in elevated levels has been associated with damage to arterial walls and increased stroke risk. Yet medication-related interference with these vitamins can quietly allow homocysteine to rise. The tragedy is that these deficiencies do not announce themselves dramatically. They manifest as subtle fatigue, muscle weakness, irregular heartbeat, or dizziness, symptoms often attributed simply to getting older rather than to an underlying nutritional shortfall created unintentionally. Over time, this gradual erosion of micronutrient status can shift the cardiovascular system from a state of efficient repair into one of vulnerability, where oxidative stress rises, inflammation smolders, and blood vessels lose their natural elasticity. The body was designed to receive these nutrients from whole, mineral-rich foods that deliver them in balanced ratios alongside proteins and natural fats that aid absorption, not in isolation, but as part of a coordinated biological message. When meals include foods like leafy greens, fish, eggs, nuts, and unprocessed meats, they provide the raw materials needed to restore electrolyte balance, support mitochondrial function, and stabilize the electrical signals that keep the heart beating smoothly. Clinical evidence shows that replenishing these nutrients can improve endothelial function, enhance energy metabolism, and reduce markers of inflammation, demonstrating just how responsive the body can be when given what it was designed to use. This is not about rejecting modern medicine, but about recognizing that physiology still follows ancient nutritional rules, and when those rules are supported, the heart often regains a level of strength and stability that no pill alone can provide, reminding us that true cardiovascular protection depends not only on managing disease, but on continuously nourishing the microscopic engines that keep us alive. Inside the human body, inflammation is not always loud, painful, or visible. In fact, the most dangerous inflammation is completely silent, unfolding deep within the lining of the arteries where it cannot be felt until the damage is already done. This hidden process, known as chronic low-grade inflammation, has been identified by researchers as one of the central drivers of cardiovascular disease, quietly weakening blood vessel walls, destabilizing plaque, and setting the stage for heart attack or stroke. Certain medications, while helpful for specific symptoms, can unintentionally disrupt the gut microbiome, the vast ecosystem of bacteria that regulates immune balance. And when this delicate system is altered, inflammatory signaling molecules can increase throughout the bloodstream. Studies have shown that changes in gut integrity can allow endotoxins to enter circulation, triggering the immune system to remain in a constant state of alert, as if fighting an infection that never truly exists. This persistent immune activation releases cytokines, chemical messengers that, over time, damage the endothelium, the thin protective layer inside arteries responsible for maintaining flexibility and proper blood flow. Once that lining becomes irritated, it begins attracting cholesterol particles not as a cause of disease, but as part of an attempted repair process, creating plaques that can become unstable under inflammatory stress. Oxidative stress adds another layer to this story, as mitochondrial function becomes impaired and the body produces more reactive oxygen species, molecules capable of damaging DNA, proteins, and lipids within cardiovascular tissue. In older adults whose antioxidant defenses are naturally lower, this combination of inflammation and oxidative burden accelerates vascular aging far beyond what chronological age alone would predict. The frightening reality is that this process does not require require decades to begin. Biochemical markers of inflammation can rise within weeks when metabolic and microbial balance are disturbed. Yet the body also possesses an extraordinary capacity to reverse these signals when given the right environmental inputs, demonstrating that inflammation is not destiny, but a response to conditions. Whole foods rich in omega-3 fatty acids, polyphenols, and natural antioxidants have been shown to actively reduce inflammatory pathways, helping to calm immune activation and restore endothelial function. When meals emphasize unprocessed ingredients like fatty fish, colorful vegetables, olive oil, and naturally raised proteins, they deliver compounds that switch off genetic pathways associated with chronic inflammation while enhancing those responsible for repair. Even moderate daily movement has been demonstrated to release anti-inflammatory myokines from muscle tissue, turning physical activity into a form of internal medicine that communicates directly with the cardiovascular system. As inflammation subsides, blood vessels regain elasticity, plaques become more stable, and the biochemical environment shifts away from crisis mode toward healing mode. This transformation reminds us that the cardiovascular system is not merely a network of pipes, but a living, responsive tissue shaped continuously by what we consume, how we move, and how we support the internal ecosystems that govern immunity. The most powerful realization is that by reducing the silent fire of inflammation, we are not just preventing disease, we are restoring the biological calm that allows the heart and brain to function the way they were designed to. Resilient, adaptive, and remarkably capable of recovery when the conditions are finally right. Sleep is supposed to be the body's most powerful form of cardiovascular repair, a time when blood pressure falls, stress hormones quiet down, and the heart finally gets a chance to recover from the relentless demands of the day. Yet when sleep is chemically forced rather than biologically achieved, that restoration can become incomplete or even disrupted in ways most people never realize. Many sedative and sleep medications act by suppressing the central nervous system, slowing brain activity to induce unconsciousness. But this is not the same as natural sleep architecture, the carefully orchestrated cycle of light sleep, deep sleep, and REM sleep that regulates metabolic healing and vascular maintenance. Scientific sleep studies have shown that certain sedatives can reduce time spent in deep, slow-wave sleep, the stage most responsible for tissue repair, immune regulation, and stabilization of blood pressure variability throughout the night. Without sufficient deep sleep, the body may fail to properly regulate cortisol, leaving stress signaling elevated even while a person appears to be resting, creating a paradox where someone sleeps longer yet wakes metabolically strained. Some medications can also depress respiratory drive, subtly lowering oxygen levels during the night, especially in older adults whose breathing control is already more vulnerable, and repeated drops in oxygen saturation have been linked to increased risk of arrhythmias, hypertension, and structural stress on the heart muscle. This phenomenon places the cardiovascular system in a state of intermittent hypoxia, where it must repeatedly compensate for reduced oxygen delivery, triggering surges of adrenaline-like hormones that constrict blood vessels and elevate heart rate when the body should be at its most peaceful state. Over time, this nightly pattern can contribute to endothelial dysfunction and increased risk of atrial fibrillation, one of the strongest predictors of stroke in aging populations. Research has also shown that disrupted circadian rhythms, often masked by sedative use, can impair glucose metabolism and raise inflammatory markers, further compounding cardiovascular risk by interfering with the body's internal clock, which governs everything from hormone release to vascular tone. Natural sleep, by contrast, is a metabolic signal of safety, initiated by darkness, stabilized by consistent meal timing, and reinforced by exposure to morning light that anchors the circadian rhythm to a predictable 24-hour cycle. When individuals align with these biological cues, melatonin rises gradually, blood pressure falls in a controlled manner, and heart rate variability improves, all markers associated with resilience against cardiac events. Simple behavioral changes, such as obtaining sunlight early in the day, avoiding heavy meals late at night, reducing artificial light exposure after sunset, and maintaining regular sleep and wake times, have been shown to strengthen circadian synchronization and improve sleep quality without suppressing the nervous system. Movement during the day also deepens nighttime sleep by increasing adenosine buildup, a natural sleep pressure molecule that the brain responds to without pharmacologic interference. The result is sleep that is not merely sedation but active physiological recovery, where mitochondria repair themselves, inflammatory pathways quiet down, and the cardiovascular system recalibrates for the next day. Understanding this difference reframes sleep not as something to be forced, but as something to be cultivated, because when the body is allowed to follow its evolutionary design, the night becomes a powerful form of heart protection rather than an artificially induced pause. And the quality of that restoration can influence cardiovascular health as profoundly as anything done during waking hours. In modern medicine, there is a term that sounds harmless, but carries enormous physiological weight: polypharmacy, the use of multiple medications at the same time, a practice that has become increasingly common in older adults as new prescriptions are added year after year while few are ever removed. Each medication may be justified individually, yet the human body does not experience them in isolation. It must process them simultaneously through the same liver enzymes, the same kidneys, the same cellular pathways that were never designed to interpret such a complex chemical conversation. Research has shown that as the number of medications increases, so does the risk of drug interactions, metabolic strain, and cardiovascular complications, not necessarily because any single drug is dangerous, but because their combined effects can alter blood pressure regulation, electrolyte balance, and vascular tone in unpredictable ways. The heart relies on precise signaling between sodium, potassium, calcium, and magnesium to maintain a stable rhythm, and when multiple medications influence these minerals at once, even slightly, the electrical system of the heart can become less stable, increasing susceptibility to arrhythmias and circulatory stress. Studies in geriatric populations have linked higher medication counts with increased rates of hospitalization, dizziness, falls, and episodes of low blood pressure, events that may seem unrelated to heart health, yet often reflect an overwhelmed autonomic nervous system struggling to maintain equilibrium. The liver, acting as the body's chemical processing center, must prioritize detoxifying these compounds, diverting energy away from metabolic maintenance and repair, while the kidneys must filter byproducts that can alter hydration and vascular resistance. Over time, this constant processing demand can contribute to fatigue at the cellular level, where mitochondria are forced to work harder just to sustain baseline function, leaving less reserve for resilience during illness or stress. What makes polypharmacy particularly challenging is that side effects of one medication are sometimes treated with another, creating a cascade where symptoms are managed rather than root causes addressed, and the original metabolic imbalance remains unresolved beneath layers of intervention. Scientific discussions increasingly emphasize the importance of deprescribing, a careful, supervised reassessment of which medications remain truly necessary as lifestyle and metabolic health improve, recognizing that the body often regains capacity when given the opportunity. Nutrition, physical activity, and sleep quality have all been shown to influence blood pressure, glucose regulation, and inflammatory status, sometimes reducing the physiological burden that medications were initially prescribed to manage. When these foundational inputs are strengthened, the internal environment becomes less chaotic, allowing regulatory systems such as the baroreflex, which stabilizes blood pressure, to function more effectively without chemical interference. The goal is never abrupt withdrawal or rejection of medical therapy, but thoughtful simplification, aligning treatment with the body's natural regulatory design rather than overwhelming it with competing signals. This approach respects the extraordinary intelligence of human physiology, which evolved to operate through coordinated feedback loops, not fragmented instructions. When the number of external chemical messages is reduced and replaced with consistent biological signals from whole foods, movement, and circadian rhythm, the cardiovascular system often finds a steadier rhythm of its own, demonstrating that sometimes protecting the heart is not about adding more, but about carefully, safely, and intelligently allowing less to become more. The human heart is not merely a pump made of muscle and valves. It is a living, sensing organ that constantly responds to the environment we create through our daily choices, adjusting its function moment by moment based on signals of safety or stress, nourishment or deprivation. Modern science has revealed that cardiovascular health is profoundly shaped by metabolic stability, a state in which blood sugar remains steady, inflammation is controlled, hormones are balanced, and mitochondria, the tiny power plant, plants inside every heart cell are allowed to generate energy efficiently without interference. When this stability is present, blood vessels remain flexible, nitric oxide production improves, circulation becomes smoother, and the risk of plaque rupture, the event that triggers most heart attacks, is dramatically reduced. Yet when the body is exposed to constant spikes in glucose, poor nutrition, chronic stress, and physical inactivity, it interprets these as danger signals, activating pathways designed for short-term survival but harmful when sustained for years. Researchers have observed that metabolic dysfunction can precede visible heart disease by decades, meaning the earliest damage often occurs silently, long before symptoms arise, in the form of insulin resistance, oxidative stress, and low-grade inflammation that gradually stiffens arteries and weakens cardiac resilience. The remarkable truth is that the body also possesses an extraordinary capacity to reverse these processes when given consistent, biologically appropriate inputs, demonstrating that healing is not a mysterious phenomenon but a predictable response to restored conditions. Whole, unprocessed foods rich in amino acids, healthy fats, and micronutrients provide the raw materials required for cellular repair, stabilizing blood sugar and reducing the hormonal chaos that strains the cardiovascular system. Regular movement acts like a metabolic reset, enhancing insulin sensitivity and stimulating the release of molecules that directly protect the lining of blood vessels, essentially turning skeletal muscle into an endocrine organ that communicates health signals throughout the body. Adequate sleep further amplifies this restoration by lowering nighttime blood pressure, regulating stress hormones, and allowing damaged tissues to repair through processes that only occur during deep natural sleep cycles. Even small, repeated behaviors, like walking after meals or eating balanced portions of protein and vegetables, send powerful biochemical messages that shift the internal environment away from storage and inflammation toward maintenance and renewal. Studies have shown that improvements in these lifestyle signals can rapidly influence markers such as triglycerides, fasting insulin, and vascular function, sometimes within weeks, illustrating how dynamically the cardiovascular system responds when the burden of metabolic stress is lifted. Rather than viewing heart disease as an inevitable consequence of aging, this perspective reframes it as the outcome of cumulative signals, many of which remain within our influence regardless of age. The heart does not demand perfection. It requires consistency, a steady rhythm of nourishment, movement, rest, and balance that aligns with the physiology humans evolved to depend on. When those conditions are restored, the body often shifts from a state of defense to one of repair, allowing the cardiovascular system to regain strength, adaptability, and endurance. This is the profound message emerging from modern research. The heart is not simply something we treat when it fails, but something we continuously teach how to function. And with the right signals repeated day after day, it can learn resilience again.